All right, so good morning, everybody. So as I
Good
mentioned,
morning.
good morning. Thank you, Arlene. As I mentioned, a couple of updates. We will be bringing on a new team member with Serving Together, and we'll be doing a little bit of a shift in terms of our team's responsibilities. And so Jason Marshall, I'm sure some of you may know, is currently our Western Maryland program manager. And starting next week on November 16th, he will transition to cover Central Maryland. So he will be your new contact starting next week on the 16th for these collaboratives moving forward. But between now and then, please let me know if there's any questions or anything that you guys need. And as we bring on our new team member, they will take over kind of the Western Maryland region. So we're really excited for Jason. So and Jason joins today. He'll be kind of listening in, but to get an update on kind of what's going on within the region. Jason, want to say anything really quickly before we keep moving?
Yeah, thanks, Christy. Good morning, everyone. I'm excited to join the group and to progress with Central Maryland for sure. Counting on a lot of you to help me with that, and continue to make Central Maryland a robust and vibrant area for our veterans active duty and their families. So look forward to working with you. Thanks, Christy.
Yeah, thanks, Jason. Awesome. Well, I also want to give a shout out to Cynthia, my co-facilitator today with the Baltimore Federal Executive Board. And obviously, these Central Maryland collaboratives are in partnership with the Weinberg Foundation, who's helped us get these started. And thank you all to the leadership from each of the communities within Harford County that are helping us run these meetings, set up speakers, and the content for these meetings. So shout out to Harford County for today for lining up the speakers for our panel discussion focused on legal assistance and the needs of our veterans. So with that, I want to move into kind of a speed networking breakout. We'll just do that for about 5 minutes, allow you guys to get to connect with a few folks that maybe you haven't met before. And this meeting, we're going to focus on what are you doing for Veterans Day. So Veterans Day is coming up. If you guys have any plans over the next couple of days, this weekend, that you're going to be doing, I'd love you to share that with the people that you'll be breaking out to. So give me a moment. I'm going to pause the recording and then move you guys into breakout rooms. All right. Welcome back, everybody. Hope you guys had a chance to connect and share about some of the things that you guys are going to be doing this coming Veterans Day. And so next, we're going to move into our panel discussions. I'm going to move it over to Silvana to introduce our speakers and our discussion for this morning.
Good morning, everyone. Just briefly introduce myself. I know I've met on Zoom in the past. Silvana Bowker, I'm a project manager at Department of Community Services. I'm very excited to have these wonderful speakers, panelists here today. So we're going to start off with Jennifer Vito. She is the Executive Director for the Bar Foundation. She is a published author, columnist, and social media specialist as well.
Good morning, everybody. Thank you. I don't know. Do we have the Swan, do we have the slides that are we going to do those or?
Yeah, sorry. Let me pull it up. Can you see that?
Yes, I can. Okay. Perfect. All right. Good morning, everybody. I'm very happy to be here. My name is Jennifer Vito, and I am the Executive Director of the Harford County Bar Foundation. We are located in the heart of Bel Air, right across from the district court, the circuit courthouse. We are open Monday through Friday from 9 to 2, and we offer a variety of services that I'm going to talk about today. The first one I want to talk about is a new program that we have. It's called the Criminal Reduced Fee Program. This is done in partnership with the Harford County district court. So we have experienced attorneys that are willing to take a case at a reduced rate. So sometimes people do not qualify for the public defender. They might be a little bit over, but really they don't have enough money to get an attorney. And so we have this program that kind of fills the gap. We also serve those that do qualify for the public attorney, but choose not to use the public attorney's office for one reason or another. And so we have the application is on our website, and we match a client with an attorney. So it's a new program. We had it many years ago, but it has been revamped. And the sliding scale has changed a little bit to better suit the needs of those that need to use the services. Next. We have two programs. First is called Lawyer on the Line. We used to do this in the courthouse, but as you all know, COVID hit and we had to revamp our program. And so we started to do it over the telephone. We could not do it over Zoom because a lot of our clients don't have access to computers. So we decided to keep it Lawyer on the Line instead of in the lobby, because the clients really like it. Because they don't have to, especially if they're at work, they don't have to leave work to talk to an attorney. They can just take their lunch break, because we do it at lunchtime from 12 to 1. And it's easier for us on our end to staff it, because the attorneys don't have to leave their office or leave the courthouse in order to help us with this program. So it's a brief advice clinic. The client can ask the attorney any question. They get 15-minute slot to ask them anything from family law to criminal to civil, just whatever their legal needs are. So this is a very popular program. We have it booked out 2 to 3 weeks ahead of time, but it is definitely serving the needs of those in the community. The next one. And the other program we have that is very similar to Lawyer on the Line is called Lawyer in the Library. And this is also a brief legal advice clinic, and we have it, our local attorneys staff this as well. And we use this one in the library since it is face-to-face. For clients that have a legal issue that maybe they have some paperwork that they received in the mail and they're not really sure how to fill out certain forms, we encourage them to attend this clinic, because they can sit down with the attorney face to face. The attorney can review the materials that they bring, and they can offer free legal advice. Determine Your Destiny is a program that we have for our seniors and veterans in our community. All of our programs are open to veterans, but this one in particular, we see a lot of veterans take advantage of it. So they're brief advice seminars that we hold at the senior centers, and they're two-part. The first week, the clients come and they learn about why you need a medical advance directive and financial power of attorney, the importance of these two documents, and why you need to have these in place before something happens to you, unfortunately. So the attorney gives them a brief overview of what the program is, and then we hand out the documents, and the clients go home and they actually fill them out to the best of their ability. They come back the next week. We have an appointment with an attorney. The attorney reviews the documents, and our office goes ahead and we notarize the documents that need to be notarized. This service is free of charge to seniors in our county. It is very popular. If you go to our website, we already have the next one set up for February. And then, is that the last one?
Yes, that's all I have.
Yes, yes. So that's a brief overview of the programs that we do offer. Our meat and potatoes of our organization is family law. We are funded by the Maryland Legal Service Corporation, and we do divorce and custody. So that's the majority of our work that we do within the county. We also provide expungement services. We do that as well. Does anybody have any questions? Okay.
Okay, thank you so much, Jennifer.
Thank you. I appreciate it.
I'm sorry, I do have a
Oh,
question. I was Mary Mahoney. I'm from Montgomery County. I'm wondering if is this all just for people in Harford County?
So we serve Harford in Cecil County, but every county has a bar foundation like us.
Okay.
So if you go to the Maryland Legal's MLSC's website, Maryland Legal Service Corporation's website, you can find the provider that's in your area.
Okay, thank you so much.
You're welcome.
And this is Bob Brown. I have one one thing. I know you said that I'm sure that they fill up pretty fast, but if you would ever want to put out something to get a wider, broad brush with veterans, and ours on the line here, and he's our social media person, we could put those out through the Veterans Commission. That would perhaps reach a broader, wider scope of the within the veterans within Harford County. So we'd be happy to do that. If you have those, like a flyer or announcement or something like that, we can put those out.
Bob, I will take you up on your offer. If I can just get your email, that would be great.
I think it should be in the chat.
Jennifer, I can email it to you too.
Okay.
That would be wonderful. Thank you very much. And yes, Bob, I will follow up with you. Thank you for that. We really appreciate it.
Okay. Our next presenter, we have Art Caff, who is Commission on Veterans Affairs. Just a little bit about him. He is a member for the Harford County Commission on Veterans Affairs since 2015. He manages the commission's Facebook page and has served as a point of contact for legal matters. Art served on active duty in the Army from 1992 to 2000 and served in the Army Reserve from 2000 to 2020. He serves as a judge advocate. His assignments in the Army Reserve include staff judge advocate positions at Aberdeen Proving Ground and commander of the 117th Legal Operations Detachment in Phoenix, Arizona. He attained the rank of Colonel, U.S. Army Reserve, and he retired in 2020.
Well, thank you very much. And I'm very pleased to be here to represent the Harford County James V. Captain Jim McMahon Commission on Veterans Affairs. And just a brief overview of our mission. Our mission is to advocate for our veterans and their families and connect them to resources through outreach and education. And our vision is a Harford County community that is responsive to the needs of veterans and their families. And our chair is Robert Brown, who is on the collaborative today, and he just spoke. And like other commissions, we are appointed by the county executive, Mr. Barry Glassman, and approved by the county council. And I'd just like to give a shout out to our upcoming Veterans Resource Fair, which will be occurring at the Bel Air Armory on Saturday, November 12th, this weekend from 1000 to 1300. And I invite all of you to attend. And as Bob mentioned, I have a social media role on the commission, but one of my roles on the commission is to serve as the point of contact for legal matters. Now, I want to emphasize, we don't give legal advice to veterans and their family members or anybody else. We pretty much just direct anybody who contacts the commission to the legal resources that are out there. For example, if we have a veteran or a family member that is facing a legal problem, we direct them to certain pro bono and reduced fee legal services. One example is the Harford County Bar Foundation, which just spoke. And Jennifer Vito, of course, gave us an overview of that. And we refer veterans that have contacted us facing a legal problem to that organization. We also refer veterans and family members to, if they're eligible, to legal assistance services on Aberdeen Proving Ground or at nearby military installations. Now, for those services, you generally have to be a military retiree or an active duty military member. And members of the reserve, we can direct them to other reserve services out there. Those who are veterans would not be eligible, so they would be directed to other resources. And we also have become aware of various clinics and seminars. Some of them have been hosted by the Harford County Bar Foundation, and we publicize them on the Facebook page. We also send out emails about these events. Now, veterans and family members that are facing an issue may contact the commission by sending a message to us on Facebook or by emailing us. Or point of contact on the county council for Harford County is Mr. Andre Johnson. So someone who is facing an issue can email his office and they'll direct, that email will be directed to the commission for further assistance. And they can also contact us by phone. So as I mentioned, we publicize areas of these events on Facebook. We also publicize area of legal interest on the Facebook page. So I'd just like to mention that as well. One example in recent weeks is information about the new PACT Act. This is a new law that, as you may know, expands VA healthcare benefits for veterans who have been exposed to toxic fumes and other hazards, such as burn pits. This is a very important piece of legislation. Since it was enacted now, veterans can get a presumptive condition rating to have that is a medical condition that qualifies them for a presumptive condition. So they don't have to show proof, in other words, that a certain condition is service connected. And finally, I just wanted to mention that recently the Harford County Council passed legislation that expanded the eligibility for the 20% property tax credit for veterans and seniors. So we publicize information about that. Now, those are merely examples of various legal issues that we've become aware of that we publicize through Facebook and through other resources. So again, thank you for inviting me, and I'd be happy to answer any questions or concerns that you may have.
Thank you, Art. Does anybody have any questions?
No, the tax credit that I'm mentioning is only for Harford County. I should mention, though, that other counties and other states, I'm aware, do have similar property tax credits that will reduce the property tax for veterans and other eligible individuals. And it's a 20% property tax credit.
Thank you. Anyone else? Okay, so I'm excited to our next panelist. We have Arlene Callender with the Northeastern Maryland Legal Aid. A little bit about her. She is a chief attorney and has a staff of 7, which includes 2 paralegals, 3 attorneys, an office manager, and administrative assistant. They run the Harford and Cecil office. They count veterans among their clients in the work, and they do in the local office, have a good relationship and support the work of other stakeholders assisting veterans. And additionally, at their headquarters in Baltimore, there's dedicated staff handling specialized cases for veterans, including service-connected disability.
Great. Thank you and good morning, everyone. Can you guys hear me? Okay, fantastic. So I bring you guys greetings from Maryland Legal Aid. And Maryland Legal Aid is a statewide organization. Our mission is to provide high quality but free legal services to Marylanders living in poverty throughout the state. And we do that by providing legal representation, legal advice, community education to targeted populations throughout the state. Many of our clients fall into the category of what we call marginalized or underserved. And that is because of the impact of poverty on the people that we represent. There is an income eligibility guideline. So you either have to be unemployed, underemployed, or live in a household with that many people that you would not be able to afford private counsel to represent you in the very important work that we do. Now, we do call it human rights work, and that's because we represent people in civil cases only. I am sure that everyone on this Zoom call today has or know of the Public Defender's Office. We consider ourselves the civil side to the Public Defender's Office. Now, with the Public Defenders, you're getting representation in an action that is criminal related and that you want to preserve your right to life and liberty. However, with Maryland Legal Aid, represent in those cases where without civil legal assistance, your life, your liberty, your freedom will not be as stable and as enjoyable. So for example, our clients include children in the foster care system, the elderly, the disabled, consumers facing repossession, workers facing wage garnishment, people trying to determine whether or not to file bankruptcy to prevent home foreclosures. And a very, very important topic right now, we provide representation to tenants in rental housing. We represent the disabled, people who are affected by drug, alcohol, and opioid abuse, and people in need of expungement of their criminal records so that they can maintain stability in employment, in education, and in housing. The biggest request that we have for assistance is for families experiencing the destabilization that divorce and domestic violence provides. We have clients who are veterans and they fall into every category of the cases that we do that I just mentioned, probably with the exception of children in foster care. However, some of the children that we do represent in foster care are children who are children of veterans. So when I say I bring greetings to everyone, particularly with the holiday, Veterans Day coming up soon, it is in that spirit of giving thanks for all of the service people, for all of the freedoms, for all of the liberties that they have provided for us. When I say we represent veterans, I mean that it is with the pride and with the thanks that all of me and my staff feel when we count veterans among our clients. Now, we represent people in Harford and Cecil County only. However, Maryland Legal Aid is statewide in each county, as well as in Baltimore City. We have either a brick and mortar office that is standalone, or we have space in either the district or the circuit court where our clients, including veterans, like I've mentioned, can either walk in to our office or call in. We have a dedicated 1-800 line. So it's not even an expense to make a call to Maryland Legal Aid. In the Northeastern office, which is what where I am and where all clients can come into our office, we are located at 103 South, excuse me, 103 South Hickory Avenue in Bel Air, Maryland, right downtown next to the fire station, a stone's throw away from the district and the circuit courts. And very often, because the clerks in each of the circuit and the district courts know and are familiar with the services that we provide, will often refer clients to walk into our offices. We're open Monday through Friday from 9 a.m. to 5 p.m. However, we can always be located online. Now, in addition to the work that we provide very specifically in our Northeastern office, I'm really pleased to say that we do have dedicated staff at our headquarters in Baltimore who handles those specialized veterans cases, including service-connected disability. Again, we are very, very happy and pleased to be able to present today. We work in conjunction with other of the local pro bono and legal services providers, including Harford County Bar Foundation, including SARC, and we join forces really in providing the services that we do to make sure that our services are extended and reach as far into the veterans community as it can. So thank you, and if there are any questions, I'll be happy to answer them.
Yes. How are you defining poverty?
Okay, so each year there are poverty guidelines put out by the federal government, and for the most part, as I mentioned before, our clients are people who are either unemployed, underemployed, who have income, but the family size, the household makes them eligible for assistance. And generally for a household of one, the income cannot exceed $1,200 per month. However, that changes annually when the federal government puts out its poverty guidelines. Now, in addition to the federal government who provides the majority of our funding, we also receive funding from Maryland Legal Services Corporation, and that allows us to raise those guidelines a little bit higher so that although one individual might have income that exceeds the national or the federal poverty guideline of $1,200 per month, because we receive additional funding from Maryland Legal Services Corporation, that person might still qualify. So it's on a case-by-case basis, but generally a monthly household income one of $1,200 or less will make an individual eligible for free legal services. So we have, it's not published, but we have those guidelines. And if anyone is interested in finding out whether he or she qualifies or whether his or her household qualifies, they should feel free to contact our office either online or by phone. And they learn at the moment of contact whether or not they're income eligible.
Does that also include veterans who receive service-connected disability payments?
That is correct. Yes, it does.
Okay. Thank you.
You're welcome, Sam.
If I may, thank you for the presentation, Ms. Callender. And I just wanted to mention that we do also, we have referred individuals who have contacted our commission to your organization, Legal Aid, if they need services. So thank you for all that you do. I just wanted to mention that.
You're very welcome. I just want to put in a plug for a new program that is in effect. It started in October. The state of Maryland now recognizes the right to housing and will provide for veterans and others free legal representation to anyone facing eviction. So there is a project called Access to Counsel in Eviction Cases, and it is all throughout the state of Maryland, where anyone who is facing eviction would be entitled to free legal representation. Our office is one part of the legal services provider for that new program. It just took effect in October. It's not 100% off the ground yet, but if there are any veterans who are facing eviction, please refer them to Legal Aid anywhere throughout the state of Maryland.
Could you repeat the name of that program? I apologize.
Yes, it's called Access to Counsel in Eviction, the ACE project.
Thank you.
You're welcome.
And thanks for that, Arlene. That was great presentation. What is there a place where we can, like, is there a website or something else? Because I work with another organization that we outside the county where we continually get people getting evicted, and that this would be fantastic.
Oh yeah, so locally you can contact our office, and I'll put our information in the chat line on the chat. And statewide, I will put that contact information as well.
Fantastic, thank you.
Yeah.
Okay, thank you, Arlene.
Very welcome.
And then our last presenter, we have Lisa Coles. She is a social work supervisor for the Veterans Justice Programs, and she's here to discuss the Veterans Court.
Hello, good morning, everybody. Can you guys hear me?
Yes.
So again, good morning. My name is Lisa Coles, and I am the social work supervisor for our Veterans Justice Programs. Our Veterans Justice Programs include our Veterans Specialty Courts, as well as our reentry program. Our Veterans Justice Program works with local counties. We're hoping that, Harford County would come along, but we work with local counties to provide diversion options for justice-involved veterans. These diversion options are primarily related to charges that are misdemeanors or less, related to substance use disorders or mental health, something that a veteran would potentially receive treatment for versus incarceration. We do have to have a court that's willing to partner with us and provide the specialty court. It would be along the lines of something like a drug court. So our veterans courts and dockets are strictly voluntary partnerships where we work with our local community agencies to provide diversion and treatment for justice involved veterans. We are social workers. We're not legal providers. We don't have legal representatives. We do partner with local organizations. Some of them you guys have referenced already, to support and assist veterans with non-felony legal matters that does not require us to be engaged with. Our reentry program, we have veterans that go out. We have specialists that go out to see veterans in the community that may be detained at our local detention centers or prisons. We try to, get them involved with veteran benefits. We get them enrolled in the VA prior to them being released. We try to negotiate liaisons and relationships with legal programs that can support some of our veterans that may be in some of the local detention centers. Our goal is to ensure that veterans come out of incarceration and that they're not homeless and they're tied into any kind of benefits that they're entitled to prior to release from incarceration. Again, we're not lawyers and the VA is not a legal agency. Our Veterans Justice Program is a national initiative to support our justice involved veterans. We do want to make sure that our community partners are aware of the justice involved, of the justice programs with the VA, hopefully to expand our partnerships and to serve our veterans in a holistic manner. Veterans have a lot of diagnoses such as PTSD and other mental health disorders that may be combat related, that kind of put them in a special position. And sometimes they find themselves involved in illegal matters that them being detained wouldn't necessarily support and contribute to their overall well-being. So we're hoping that more counties will come along to partner with us for veterans courts and dockets to assure that our veterans are able to get the attention that they deserve. We are currently partnering with Dorchester County courts. They cover about 4 courts in the Eastern Shore area. We partner with Baltimore City District Court. We partner with Anne Arundel County Court, and we're hoping to expand our veteran specialty courts to other counties in our catchment area. We work with every jail and prison within the VA Maryland healthcare system catchment area, and that spans from Howard County again to the Eastern Shore. The other counties are in the metropolitan DC area. But every VA medical center has a Veterans Justice Program. Some of them are bigger than others. We have one of the biggest and some not so big, but these are services that are nationally mandated so that we can continue to provide auxiliary supports and services to our veteran populations. The Veterans Justice Program does come under the Veterans Homeless Program, but a veteran does not have to be homeless to be a participant in the Veterans Court or to be assisted by our justice liaisons. So I put my contact information in the chat. I was having some technical difficulties this morning getting on. So if anybody has any questions, we are, our liaisons are all over the place. We really try to be present as much as we can to share and try to be inclusive and continue to partner with any and everybody that's willing to assist us in supporting our veterans in every way. Do you have any questions?
Hey, Lisa, Bob Brown. Do you know, and I don't, I'm not trying to put you on the spot. I just wondered, I talked with Heather a while back, but do you know how many you see, how many veterans go into the program per year? And one of the reasons I'm asking this is because we have been trying, as you know, and to get this at Harford County, forever, at least for the past 8 years. And we may be able to do that now in the next couple of years, but they're asking for some data. So one of the things they asked for is how many people in these other counties, how many veterans go through this program on an annual basis? Do you have a ballpark figure there that you would know, or that you could maybe send me?
Well, what you would be asking me about specifically would be county by county. So Baltimore City naturally has one of our largest veteran sockets. But again, like Dorchester County, they're more of a rural setting. So it really depends on where you're located. It's easier for the courts to get that information than it is for us. We do have a relationship. We do have a veterans justice person that does outreach at Harford County Detention Center, for instance. And we have been able to get a veteran status on the assessment and intake sheets. So the particular counties kind of identify whether or not they feel like that there's enough veterans needing their assistance. They kind of make that determination whether or not it's worth them starting a docket. So again, like for instance, Dorchester County, they have 4 counties. So, they can kind of absorb that number, but they still aren't, with 4 counties, have the same number of people that Baltimore City may have, for instance. So we can take a look at the numbers because again, we have met with Harford County and really would like to do something there, but the numbers really comes from the intakes and whether or not, veterans are being identified at intake. And the detention centers also contact us if a veteran does identify themselves and would like to engage with us. So they'll call us to come out and see people at the detention center. But the court, as a specialty court, is really motivated by the numbers at intake and whether or not they feel like that they can actually conduct a docket based on those numbers.
Okay.
But we can talk offline about it because I think it depends on jurisdiction to jurisdiction.
Yeah, that intake that you're talking about, and we can talk more offline about this. Is that a VA person that gets that, or is that from the county person that sends that?
That comes from the county. So most of the counties have, a relationship with us where their intake form, they will identify a person. They'll give a person the opportunity to identify themselves as a veteran. So you don't necessarily even have to be healthcare eligible veteran. So I want to clear that up too, because a lot of times people think that if they're not a healthcare eligible veteran, which is someone who served 24, consecutive months of active duty service, that they're not considered a veteran. That's not true. So we do have resources for all persons that have served. Healthcare eligibility is different. Just like, veterans benefits are different. Healthcare eligibility is different. However, our partners do most of the time allow people to identify themselves as a veteran or not. So based on their identification at intake, coming into the detention center, coming into, the local jails and courts, even the specialty courts. So if they're going to a drug court, they still have an intake form where the person can identify themselves as a veteran. And then they'll bring us in to hopefully support that person, give them some kind of guidance if they're not attached to the VA, and see if we can do a diversion. So some of the courts, even if we don't have a relationship with them, if it's a veteran that could, be afforded substance use treatment versus incarceration, they'll work with us. They'll allow us to do that deferment. We're not a reporting agency. So for people that are in the specialty courts and they may not be compliant to, the treatment goals, we do not have a responsibility to report. But again, a lot of the courts have gone through extensive training to become a specialty court. So they know all the, do's and don'ts and what we can do and what we cannot do and what roles we play and what roles they play. But veterans are identified at intake.
Okay, thank you.
No problem. Thank you.
Bob, have y'all
Thank
had
you.
a conversation with Richard Barton from the Maryland Judiciary? He did a great presentation for the Frederick County Veterans Advisory Council a couple months ago, where he was breaking down that data, how that system works. Have y'all had a sit down with him yet?
We haven't, because a lot of times that information is used to develop additional resources in the community. So again, the Veterans Justice Program is an auxiliary component to the medical center. So we normally are available to partner with our community partners. So for instance, again, if Harford County wants to do a veterans specialty court or a veterans docket, then we'll partner with them. We'll be able to come out there and provide the treatment alternatives to do the case management. But also veterans have a right to refuse. So even in the specialty court, they can refuse VA assistance, VA healthcare. They may be somebody that's working in the community, are really concerned about their, security clearances and things of that nature. So they may not necessarily want to partner with the VA. They have health insurance, so they want to go through, their private insurance. But it's strictly a voluntary program for us as a support to our community partners that want to work with veterans specifically from a justice standpoint. So if you have a program, you have data, you want to start something, we're here to support that initiative.
Thank you, Lisa. I just want to be mindful of time, but just wanted to thank all our Harford County panelists today, and I will pass this on to Christy.
Thank you guys so much. And thank you again for all the presenters, such helpful information. I know within serving together, our peer navigation team has seen a rise of legal assistance requests. And so this is really beneficial for us to learn about some of these services. And so with that, I want to pass it over to Beatrice Mendez, our senior peer navigator, to share just a few updates on what we're seeing in the coordination center this past month.
Morning, everyone. I'm Beatrice Mendez, the Senior Veteran Peer Navigator within Serving Together. So just wanted to give a couple of data points that we saw, at least for the month of October in Central Maryland. We saw a couple of, one of our biggest service types for that month, and I'm gonna talk about the three that we saw were income support, legal, and benefits navigation. Income support and legal are one of the top two, and those keep being consistent, not only just in Central Maryland, but in DC, Maryland, and Virginia. We have seen a kind of a 50-50% also in the age population of the veterans requesting assistance, where we're 50% of the age group in Central Maryland that are doing assistance requests are age 18 to 44, and then the other 50% is ages older adults, 45 to 64. And again, when it comes to legal, they're asking for, they have eviction notices, court hearings. We're seeing unemployment compensation, things that also courts also going into, even for benefits navigation, they're going to court for. And again, and that's why you see benefits navigation as one of the service types that we've seen in Central Maryland. And, within that work, we have reached at capacity when it comes to like income support. A lot of these providers and network are at capacity, and we're trying to find the best resources we can out of network to be able to assist these veterans coming in. But also when it comes to legal, we're also very slim on the resource we have in network. So we're doing a lot of research and trying to find the best resources we can give them. But again, it's not a guarantee that they will find it. And we try our best to follow up with them as well to make sure, that they did call the resources we provided. If they need to come back, we always tell them to, try to email us back, call back the peer navigation line. Again, they're coming and calling for major service types. Right now, it can just be legal, but maybe next month they're going to need assistance with financial or food assistance. So I make sure to tell them to call us back if there's any other service type that arises within the next couple of months. Again, they're just looking at what the major need is in that moment.
Thank you, Beatrice. And again, in terms of like legal, obviously it can be something that causes a catastrophic need for them, especially if you have to pay a lot of money for legal assistance. That can really put you behind in things like rent and utility bills and all of that. And so we're seeing kind of those the challenges and hurdles that are causing all of that and causing this kind of domino effect in their lives. So I appreciate you sharing some of that insight from the Coordination Center, Beatrice. And if you guys have any resources, especially in regards to individual and family support, we would utilize that really readily. So thank you again. And awesome. So with that, I do want to kick it over to Melissa Huber with the VA. And we're going to talk a little bit about some of the VA trainings that are offered, especially in regards to suicide prevention. We want to see if you guys have an interest in receiving training and what type of training you would like. So Melissa, I'll kick it over to you.
Hi, everyone. Good morning. So we provide several trainings and they can be done either online on your own time, or we can also come to, your organization and provide trainings. One of the first ones we have is Introductory Gatekeeper Save training. And that really helps folks to act with care and compassion if you encounter a veteran who's in crisis or experiencing suicidal thoughts. And we also have an advanced gatekeeper training for police. And this really helps. It's based on what QPR, which stands for Question, Persuade, and Refer. And there are really 3 simple steps that anyone can learn to help, help someone who is having a suicidal crisis. We also have suicide prevention in healthcare settings to help with, people learning, healthcare professionals learning how to screen for suicide risk. We have mental health apps. These are apps that can equip you with the tools and information you need in managing PTSD, stress, learning how to practice mindfulness, strengthening parenting skills. We can provide a training on that. We have what's called Suicide Prevention 101, which gives you general information on suicide prevention, really can be done with any kind of audience. Whole health and wellness. We are really at the VA trying to advance whole health to transform healthcare and improve the lives of veterans and healthcare teams, including families and friends. Military cultural competence. So we sponsor a plan to develop and implement online military cultural training curriculum for healthcare professionals, and that is available. But we also have peer support specialists who are, veterans and come and talk about military culture. It's very informative. If you have not been exposed to the military, it can give you a lot of information about working with veterans, service members, and their families. We also have a lethal means training, and we're not just talking about firearms. We're talking about medications, sharp instruments, anything that is an intentional voluntary practice to reduce one's suicide risk. And then finally, we do a VA 101, which the VA can be complicated. There's a lot of different areas, and just helping people understand things like basically how it's set up, eligibility, what services we provide. So I can certainly send, a handout that has all of these listed. And if you have any questions about it, please contact me. My information is in the chat. Thanks.
Thank you so much, Melissa. And I just put up a poll. I got a few responses on it, but we'll also share this in the follow-up notes as well. So if you guys have interest in participating in some of these suicide prevention trainings, we're looking at either scheduling one separately for this group or potentially incorporating it in with a future meeting. So appreciate you guys taking the time to share if you are interested in these, and if you are interested in any future ones as well. I'm going to put up one more poll for you guys. And this is just to evaluate how the collaborative was for you guys today. So thank you all for attending. Our next meeting will be on December 14th. We'll be focusing on the topic of individual and family services. And Howard County is going to be our partner for this meeting to really bring in some great speakers. So Lisa Terry has helped us connect with Kim Eisenrich, the administrator of the Howard County Office of Local Children's Board in the Department of Community Resource and Services. And so she'll talk about some of the resources available there. And then Emily Lequerca, I can't know if I'm saying her name right, is the program manager for Maryland Access Point of Howard County. And she'll speak about Office of Aging and services, especially around caregiving and more. So we look forward to seeing you all on December 14th, 9 a.m. We'll be holding it virtually via Zoom again. And as you guys, as I mentioned earlier, Jason Marshall will be kind of taking the lead on that at that point. So we look forward to seeing you all then. Thanks for participating today, and have a great rest of your day.
Have a great Veterans Day, everybody.
Thank you.